Hi, my name's Jen. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment on you. I'm going to be asking you just a lot of questions today, okay?
Alright, sounds good.
Okay. I'm going to assess your alert and orientedness. Can you tell me your first and last name?
Nick Lloyd,
Okay, can you tell me your birthday?
March 31st, 2001,
Okay, where are you right now?
at my house.
And what year is it?
2025.
Perfect. Okay, patient is dressed appropriately for the climate he is in. He's well nourished, no acute distress. I don't see any work of breathing, any labor. He's sitting here comfortably, so we can continue with this assessment. Excuse me. Okay, I'm going to test your muscle strength. So what I want you to do is I'm going to push on your shoulders. I want you to scrunch your shoulders. Beautiful. Can you look down? Good. Up. You look to your right and to your left. Perfect. Okay, while I'm here, can you give my fingers a good squeeze?
Yep.
Nice and good. Okay, uncross your legs. Can you push against my hands? Can you pull your toes up towards you? Perfect. Yeah. Okay, so now I'm going to test your sensation. What I'm going to do is I'm going to poke you with this. It's not very sharp. I'm going to poke you with this in parts of your body, and I want you to tell me if it's dull or sharp. So this is dull, and this is sharp. Okay, can you close your eyes for me? Okay.
Dull, my right arm. Sharp, left arm. Dull, right arm. Dull, left arm. Sharp, right shin. Sharp, left thigh. Sharp, right thigh. Dull, left shin.
Okay, you can open up your eyes. Okay, so now I'm going to assess your head down. So what I want you to do is I'm going to take my flashlight. I want you to look at my nose. I'm going to shine some light in your pupils.
Okay.
Beautiful. Can you take a look at the tip of my finger and follow it to your nose? Perfect. Pupils are equal reactive round to light or reactive to light, and pupils are, his eyes are accommodating. So now what I want you to do is I'm going to check your deep tendon reflexes. So I want you to keep nice and relaxed. I'm going to take this hammer and kind of hit the back of your arm a little bit. Keep your arm nice and loose. Perfect. I'm going to check your brachio. You're going to feel me have a tight squeeze. Perfect. Now what I want you to do is I want you to relax your arm. Perfect. Okay, now I'm going to do this side. Okay, I'm going to lift your arm nice and relaxed. Perfect. Okay, now I'm going to do your wrist. Perfect. Okay, now I'm going to do your knees. Okay, one more. Perfect. Okay, now I'm going to hit the back of your ankle. You're going to feel me touch your leg. Perfect. Awesome. And now what I would take is I would take the bottom of this and I would scrape the bottom of his foot all the way down to check for the Bushinski reflex, which he does not have a reflex. Okay, now I'm going to take a look at your nose. Any trouble breathing, any stuffiness? No, good, okay. Any trouble swallowing, any trouble with anything like that? Good. Can you open up your mouth for me? Can you stick your tongue out? Can you move it side to side? Can you puff your cheeks for me? And blow a kiss. Good, perfect. Okay, so now I'm going to look at your neck. So can you turn this way? Perfect, so I'm going to take a listen to your neck. I don't see any JVD, any jugular vein distension. So that means most likely he does not have a lot of fluid overload. Now I'm going to take the bell of my diaphragm and I want you to take a deep breath in. Good. Breathe out and hold. Good. Okay, I'm going to listen on the other side. Take a good breath. And hold. Good. I don't hear any bruising. Okay. So now I'm going to do my respiratory assessment. He doesn't look like he's having any trouble breathing. Again, sitting here comfortably. Looking at his chest, I don't see any barrel chest. Everything is nice and equal. What I want you to do is I just want you to breathe normally. I'm just going to be feeling on the front and the back of your chest. Okay, I'm going to feel the back. Okay, lung expansion is equal. I don't feel any crepitus. You didn't have any pain when I was touching. Beautiful. Okay, so now I'm going to take a listen. Okay. And breathe nice and easy. Okay, I'm going to have you take a couple deep breaths. You just let me know if you get dizzy or anything.
Okay.
Deep breath. Okay, 2 more. 1 more. Awesome. Everything sounds nice and clear. I don't hear any crackles. Again, I don't see any labored breathing, any cyanosis, any bluing of anything. Okay, next, while I'm on the chest, I'm going to do a cardiac assessment. So I'm just going to take a listen to your heart. I want you to breathe nice and normal, okay?
Okay.
So right here, I'm listening to the aortic valve. I hear S1, S2. Pulmonic valve. Tricuspid valve. And right in the apex, I'm going to listen to the mitral valve. I don't hear any friction rub. I don't hear any extra S's. I don't hear any S3, S4. I just hear S1 and S2. And I don't hear any whooshing or murmurs. Excuse me. Okay, so now I'm going to just go down your arm and your legs, and I'm going to feel the pulses in your extremities. I'm going to feel your brachial pulse. Nice and equal. +2. His radial pulses are +2, nice and equal. While I'm at the hands, I'm going to check his capillary refill. Less than 2 seconds, which means he's got good perfusion to his hands. And while I'm on the temperature, he has nice warm hands. That means he's, again, got good perfusion. To feel the pulses in the back of his knees, I would have pulled his pant leg up a little bit, but I can probably feel it through the back of his pants. Nice and equal. Okay, now I'm going to check your pedal pulses. Perfect, +2, nice and equal. Okay, so now what I'm going to have you do is I'm going to have you stand up.
Okay.
And what I want you to do is I want you to take a few steps that way.
Okay.
Okay, and now I want you to walk on your heels a few steps towards me. Perfect. Now turn around and walk on your toes. Okay, and last I'm going to have you do heels to toe, like walking in a straight line, like how police officers do. Perfect. Nice and equal gait. You can go ahead and sit down. Okay, so lastly, I do not have a exam table. What I would have him do is I would have him lay flat. I would inspect his belly, make sure there's not any veins popping out, any discoloration in the belly. I would inspect it. Next, I would auscultate, so I'd take a listen to his bowel sounds. So I would listen to all 4 quadrants. Okay, all 4 quadrants have bowel sounds present. Next, I would palpate. I would lightly press on all the quadrants of the belly to make sure I don't feel anything firm, any masses or anything like that. And then I would also ask about bowel regimen. I also, when I auscultated, I didn't hear any bruits. I didn't hear any extra noises. I listened to all of the arteries, the aorta, everything in the belly, and I did not hear any bruits. So upon my assessment, this patient is healthy, and I did not find any abnormal results from this assessment. Thank you.